Hi everyone, welcome to my channel. My name is Tova McCall and I am a licensed clinical social worker based out of the New York City area. This is Holistic Bump. Today we are talking about fertility in the preconception period, before pregnancy. The IVF journey is not something we will be touching on today, but more about understanding fertility before you know whether or not you need to seek out fertility support and treatment. We will be discussing and addressing IVF in another segment of Holistic Bump. Main questions that arise during the prenatal stage are, I've never been pregnant before and never had a scare, so can I even get pregnant? When am I the most fertile? And can I get pregnant while on my period? I will be answering these questions for you today. The information I'm sharing with you are from my years of training and experience as a certified perinatal mental health clinician. First question, can I even get pregnant? Well, obviously, I'm not speaking to one person in particular, so your fertility journey will look quite different than the next person. But fears of being fertile is real. As a therapist, I encounter many women in my practice who haven't started trying yet. They're already afraid of having complications or difficulties while trying. As you may know, it is completely irrational to be worried about something that hasn't happened yet. When you have these potentially irrational or unhealthy thoughts that enter your head, I like to utilize something called Socratic Questioning. Socratic Questioning is based in CBT, or cognitive behavioral therapy, and follows a series of questions that ask yourself to dispel some of your irrational fears or anxieties. Let's go through Socratic Questioning when it comes to the irrational fears surrounding fertility. Just a note, there are several different variations of Socratic Questioning, and the ones I go over today are just ones I find the most useful to work through. First, we need to identify the irrational thought, which in this case may be, since I've never been pregnant in the past, probably can't get pregnant, and therefore I'm probably infertile. Second, we look at the evidence that this thought is true or not. What evidence do you have that this is a truthful thought? Have you had unprotected sex and didn't get pregnant? Or are you basing your thoughts on other people's experience? Meaning, you know a few people who've undergone IVF and therefore think this probably could be the case for you. This is confirmation bias. Third, we want to look at the evidence and understand if the evidence is based on facts or feelings. The evidence is that you've had unprotected sex in the past and didn't get pregnant, and therefore you think you may have fertility issues, then that thought is more based on facts. However, if the thought is that your friend is having difficulties getting pregnant and therefore you think you're also having difficulties conceiving, that evidence is based more on feeling. Fourth, we want to see if this thought is just black or white, or if this is more nuanced. Have you tried to get pregnant for several months and it hasn't worked? Or are your thoughts based on your mom having had difficulties getting pregnant and you're connecting her experience with your possible outcome? Fifth, we can ask ourselves, is someone else passing on this thought to me? And if so, are they a reliable source? Was it a doctor who told you have low egg supply and decreased ovarian function? Or just a friend who told you, now that you're 35, you really should think about freezing your eggs because you'd be considered a geriatric pregnancy if you got pregnant? Which, by the way, is an old, antiquated term and should probably change with our changing medical world and life expectancy. Sixth, and my most favorite Socratic question is, what would you tell your best friend who had the same exact thought if she came to you for advice? Would you agree with her that, yeah, it makes sense, you're worried you could probably be infertile because your friend Julie was infertile? Or would you more likely say to her, you know what, one doesn't have anything to do with the other, so it's very possible you can get pregnant. You don't have evidence to say otherwise. Last question in this Socratic Questioning series is, what is the worst case scenario? Let's say, yeah, you are someone who will have difficulties getting pregnant. What will happen then? Well, more often than not, we can rationally say that after months of trying, we will talk to a fertility doctor and undergo some tests, maybe try some fertility interventions like IUI, maybe even IVF, and just take it one step at a time. I highly recommend Socratic Questioning for any intrusive thoughts and use this method with a lot of my clients. Ultimately, the goal is that you get to a point where you can say to yourself, you know what? I'm overreacting, I'm overgeneralizing, and I need to think more clearly. These negative thoughts are not serving me in the long run. You're training your brain to think more logically and less emotionally. Okay, the next question is a more scientific question, which is, when am I the most fertile and when should I really try to have sex with the goal of getting pregnant? Believe it or not, your fertile window is quite small. You can literally blink and miss it, which is why, despite being an overpopulated world, getting pregnant isn't that simple. There's really only a 1 to 3 day window of fertility per month, which if we look at it, out of 365 days in the year, that only gives you 12 to 36 days in the year to get pregnant. Now, let's look at an average menstrual cycle. Day 1 to 5 is when bleeding occurs, or what we call the menses phase. The eggs that were developed in the previous cycle did not fertilize and are now being released. Day 6 to 14 is the follicular phase, which is when new follicles develop and the uterine lining prepares to receive a fertilized egg or embryo. Day 14 is often when the egg drops and is able to be fertilized by sperm. 1 day. Day 15 to 28 is the luteal phase, where the egg travels down the fallopian tube to the uterus. If fertilized, the embryo may attach to the uterine lining. Otherwise, the lining will shed and the cycle will begin again. Therefore, getting pregnant is not as simple as just having sex. You have to have sex at precisely the right time. There are a few ways to figure out when your right time is. You can get ovulation strips, which are like pregnancy strips, but in this case, lets you know exactly when you're ovulating. You can test your basal body temperature every morning, and as soon as you see a 0.5 degree temperature increase, this is an indication that you're ovulating. Of course, this method is the most tedious and most difficult to track and figure out your fertile window. And more conventionally, you can get a fertility app tracker. Personally, I ended up using a fertility app tracker and thought it worked pretty well despite the fact that I experienced irregular cycles. One tip is that if you want to try seriously for the first month, have sex every other day during the follicular phase, every day during the fertilization phase, and every other day during the luteal phase. Since each phase will look slightly different for every individual, it helps to cover all your bases. Just keep in mind that sex will begin to feel like a chore rather than an enjoyable act. And last question, can I get pregnant if I have sex while on my period? The short answer here is probably not. It is super uncommon and unusual to get pregnant while on your period. That doesn't mean it's never happened, but it also depends on how long or how short your menstrual cycle is. If you have a long menstrual cycle over 30 days, then it is probably uncommon. However, if you have a short menstrual cycle under 28 days, then it could be possible, although still quite unlikely. Thank you for watching. My name again is Tova McCall, and I hope you've learned a thing or two about fertility in the preconception or pre-pregnancy period. Please subscribe to my channel, Holistic Bump, where we talk about pregnancy-related topics all the way from trying to conceive until the first year after birth.